Hey, it's Larry. Thanks for listening. Happy New Year. Real quick, before we get into this episode, I had such an amazing, eye-opening, life-changing experience at the World Parkinson Congress in Kyoto that I want others to have that opportunity too. So Becca Miller and I and 24 of our PD community friends have launched a year-long WPC travel grant fundraiser. We're each doing a 2-week Facebook fundraiser. Mine's underway right now because my birthday's January 9th. All the money raised will be used to help offset travel costs so more people with young onset Parkinson's can attend the next WPC in Barcelona in 2022. You can search out details on the When Life Gives You Parkinson's Facebook page or donate directly to the WPC website. Go to wpc2022.org/YOPD fund. If you or your business would like to supply matching funds, hey, good on ya. Email me at parkinsonspod@curiouscast.ca. And now, on with the show. It's time for another extra dosage episode of When Life Gives You Parkinson's. I'm Larry Gifford.
And I'm Niki Reitmeyer. Extra dosage episodes are those in-between bits, special bonus content to get you through until the next full episode.
Niki, in the last episode about working with Parkinson's, we heard a little bit from Dr. Robert Duff. He's a neuropsychologist.
Ooh, fancy.
Yes, very fancy. He's also the host of the Hardcore Self-Help podcast. He's the author of the Hardcore Self-Help book series.
And he knows about Parkinson's?
Sure, yeah, absolutely. And you're going to learn a lot. We get into psych assessment, counseling, cognitive impairment, and why it's important for people with Parkinson's to pick up a new hobby.
Oh.
I started by asking him, what is neuropsychology?
At least in the U.S., a psychologist is somebody who has a doctorate level degree in psychology. They can do a variety of different things. I myself, in addition to neuropsychology, I do like therapy, like psychotherapy, talk therapy. Not all psychologists do, though. Some just prefer to teach. Some do research. You can do all sorts of different things. So neuropsychology is a subfield within psychology. So you get your degree in psychology, and then you do some additional training in this field, which is basically looking at people's thinking skills. So looking at how the brain is working, behaviors too, stuff like that. And a lot of it has to do with doing assessments of people to see where their thinking skills fall in relation to their peers. So looking at things like memory, but things like language as well, processing speed, how somebody is organizing themselves, all sorts of different stuff like that. And all those different skills roughly map to a certain area of the brain, and this can help us guide treatment for neurological issues like Parkinson's or Alzheimer's disease. It can also help us understand maybe the effects of a brain injury someone had in a car crash. All sorts of things can affect someone's thinking skills. Actually, a really frequent question that I get is this just depression? Because really bad depression can make you have a hard time with your memory and how quickly you're thinking. Or is it something like a dementia condition? So,
right.
Primarily for a neuropsychologist, you're going to be doing a lot of testing, a lot of interpreting of test results and giving people feedback about how they did on that. Often, also doing presentations for organizations about, how the brain works, aging, things of that sort.
And do you work regularly with people with movement disorder?
I do. Very often Parkinson's. So not all neuropsychologists do. It is common for someone with a movement disorder to get a neuropsych assessment. But I, in particular, one day a week, I work actually at a neurologist's office, and he's a specialist in movement disorders. So yeah, I see Parkinson's and then a lot of Parkinson's plus conditions. So things like Lewy body disease or progressive supranuclear palsy, all that other fun stuff that can come along with, the Parkinson's symptoms.
You say fun, I say horror.
Yes. Yeah. Those are, Parkinson's is bad. All these other Parkinson's plus conditions are bad in extra ways. So yeah, they're horrible.
Your experience with Parkinson's, what's that been like?
Well, I had not had a lot of personal experience with Parkinson's prior to getting into the field. Since then, I've basically every week I'm seeing at least 1 to 2 people who have some sort of Parkinsonian condition, or at least that's a question there. And my experience of it is it looks different for everybody. It looks very different for everybody. I am always surprised by things that sort of fall under the Parkinson's umbrella. Somebody who says, well, my skin stopped producing a lot of natural like lubrication, so I'm dry all the time, and that might be a Parkinsonian symptom because of the way the body's reacting. So seeing how it presents differently for everybody is something that's been really interesting for me, and just seeing how people take it in stride. There's as I've been working with people, there have been more and more interesting ways of trying to cope with it. Things from like the neuro boxing class that they have over here, where people are doing boxing to get some aggressive exercise, and that seems to be helpful, to music therapies and all sorts of interesting stuff. It's an interesting condition because it's not the same as, say, Alzheimer's disease, where you have this fairly short time window, all things considered, and there's a really I wouldn't say predictable, but we know things are going to progress and get worse and worse and worse, and a person's going to have a really hard time in a relatively short amount of time. With Parkinson's, it's so variable. I've known people who have had Parkinson's for years and years and years and years, and the progression is just so slow that they have a really good quality of life. Other people, it's a little more fast and furious, so just the individual differences are really interesting to me.
Yeah, and that's really one of the mental blocks that I have. One of the things I wrestle with is like, yeah, I know I'm not going to die from Parkinson's, but it's like death of 1,000 cuts, because every time you turn around, you lose the ability to do this, or you lose the confidence to do that, or something else is triggered, and it's like, man, if it's going to be like this for the next 20 years, like I almost would rather say it's going to kill you in 5, and let me make the most of those 5.
That's a good point. I think that's the difference between, in my field, we talk, obviously about a lot of different mental disorders, and there are certain types of mental health issues or neurological issues that have like a sort of the more severe and what a lot of people would call the less severe version. So take autism, for instance, people with autism spectrum disorders, people who would be identified with Asperger's, they would consider that higher functioning in some ways. And people will say, well, it's a less severe form of autism. No, it's not. It's not less severe. It's just different, and same for like bipolar 1 versus bipolar 2. Just because something isn't as hard hitting doesn't mean it's easier. So I definitely hear what you're saying, that, it would almost be easier sometimes to just know what the heck you're dealing with. And when you talk about this isn't going to kill me. Well, there's a lot of different types of death, and I think one thing that you deal with, and anybody who is living with Parkinson's deals with, is the constant death of what they expected. You expected your life to go a certain way in so many different domains, whether it comes to how you interact with your family, how you participate in sports, if that's something you're into, how your mind is working, these things that you've counted on, you have to let that expectation die in all these different ways and adjust to what is going to be happening that's different than that.
Yeah, my wife and I talk about mourning our pre-Parkinson's life.
Oh, 100%. Yeah. Yeah. The mourning process is real. And that's another thing that's going to look different for everybody. I mean, it's normal to be pissed off about that. It's normal to be confused by it. It's normal to be in denial. The fact that like anything will change. All those stages of grief, they happen too with grieving a life that isn't going to be the same.
One of the fears that I had initially, and I suppose it's still there somewhat, and I suppose it probably with a lot of people with a degenerative brain disorder, is the fear that my cognitive abilities are going to be attacked and wane. Yeah. Cognitive impairment doesn't happen to everybody with Parkinson's.
No. The cognitive changes interact with everything else too, to be clear. Especially if someone's getting older, there might be things like hearing loss that start to take effect. Mm-hmm. And obviously with Parkinson's, you have physical issues. So when you're trying to if you're doing a project, say you're trying to build a model or something that has some fine motor control, that has some planning to it, maybe the slowing down in your thinking will get in the way, but that's going to be sort of amplified by the fact that it also takes more effort to do everything. Yes. So it's going to be more exhausting. It's going to take special planning to make sure you're not going to accidentally throw a piece down a garbage disposal or something, whatever it is. You got to put more effort and thought into that. So they definitely interact.
When should somebody with Parkinson's seek out psychological help?
So that's a good question. So, I mean, there's a difference in what we're talking about here between like psychological and then neuropsychological, like we had talked about with the testing. Right. First step is, I think that anybody who has Parkinson's should make sure that they're seeing a neurologist. Interestingly enough, a lot of people don't. You'll find out that somebody kind of got a casual diagnosis of Parkinson's from their primary care physician and then kind of just left it at that. there's a lot more to Parkinson's than just, checking off the boxes and saying, okay, well, here's some, dopamine medication and try to live a good life. A neurologist is a brain doctor. They're a medical doctor that focuses on the brain. It can be confusing because there's a neurologist and a neuropsychologist we're talking about here. The neurologist is the MD, the medical doctor. Neuropsychologist is me, the psychologist, the PhD that focuses on the brain. But the neurologist, the medical doctor, will be the one to do, more extensive brain imaging, to, look at what your symptoms are, do all the physical tests that come along with Parkinson's, lab work, really put all the pieces together to determine, is it Parkinson's that you're looking at, or is it some other disorder? And what are the best courses as to what to do about it? So in that process of that initial neurological evaluation, very often that's when I will encounter somebody. I'll be part of that whole puzzle. So this person's going to have their first meeting with the neurologist, then they're going to get sent for brain scans, lab work, and testing with me. Then the neurologist will be the point person that pulls all that together to determine kind of the final diagnosis and the plan from there. Certainly people can, and it's going to be different regionally. I can only speak from my own experience being in, California and the USA, but people can also seek out assessment from a neuropsychologist individually if they're just concerned about their thinking skills, or they could ask their neurologist or doctor for a referral if they think, okay, I know that sometimes people, about half the time people with Parkinson's do start getting some sort of cognitive impairment, and I think that I'm noticing, maybe my word finding slipping, or I'm just unsure. Default to asking for help. Try to figure out if there's a way for you to get assessed for that. One of the things that's good about the type of testing we do is it helps to take the guesswork out of things, because there are changes that happen with aging. You do slow down with aging. You do have a little bit more word finding difficulty. Some of these things we already talked about, but it shouldn't be causing you significant problems in your day-to-day life. But it can be freaky, when you know that you have Parkinson's and there's some things changing. Is it because of the Parkinson's or not? That's where this type of assessment comes in. We can look at the scores, see how you're doing in comparison to where you should be for your age, and to what pattern it follows. And that can help us say, okay, you're actually doing quite well. Your Parkinson's isn't causing cognitive impairment. You're just freaking yourself out. Something like that.
And what are those tests like?
Yeah, they're interesting. They're all a bit different. Depending on where you go, there's going to be a different, we call it like a battery of tests. So you're going to get a different battery of tests depending on where you go. Usually it's a longer experience. So we, at my practice, we have a pretty nice and tight protocol that we use where we combine different tests to get all the information that we need. Our whole process usually takes about 3 hours, and it's like in a single day. So you go through about an hour of interview and then 2 hours of testing, though that can be longer or shorter depending on the particular case. But you're going to be doing things like, so memory tests. You're going to have somebody remember a list of words, and then you're going to see, can they remember those words after a short delay or after a long delay? If they can't remember the words, can they at least recognize them when they hear them? If you say some words that were on the list, some words that were not, will they be able to tell the difference between them? There's going to be differences in how people perform on tests like that. If they have Alzheimer's versus Parkinson's versus, no cognitive issues at all, versus depression, we can kind of find those patterns. So certainly memory tests, and for basically everything, you're going to do a visual version and a verbal version of it. So, having you remember a list of words versus having you remember some shapes and pick them out later. So memory stuff is pretty straightforward. You'll also do tests of executive functioning. So having to do some tests of multitasking where you kind of switch back and forth between different demands. Some tests that are looking at if judgment is an issue, asking you questions related to judgment. Definitely you'll be doing reasoning things like looking at IQ, your intelligence and reasoning level. Lots of processing speed tasks that we talked about. These would be basic things, but having to do them under time pressure. They're all pretty short. To be honest, all the tests are like 5 or 10 minutes long, but you just do a series of them one after another to get the whole range of functioning. Some places do more extensive assessments, especially if it's like a training clinic where they might be using graduate students. They might have them do more extensive testing, especially if it's part of research or anything like that. So you might be looking at several testing sessions, so maybe 2-3 hour sessions or something like that. But most of the time when you're in kind of a clinic situation, it's going to be a little bit tighter than that, more along the lines of what I was talking about.
Right. Now, are there like exercises that you can help yourself in, delaying the cognitive erosion?
So it's a little bit hard to say. What we do know is that like brain games like Lumosity and things like that are, while they're better than nothing, they're not effective in slowing down cognitive impairment. They can provide kind of like little boosts to certain skills, but it's basically you're practicing that skill and getting better at it. Some of the newer research suggests that what's actually more helpful in kind of delaying, slowing down progression and also improving thinking skills is outside of like the games and practicing memory exercises and things like that, but actually just learning skills in your life. So there was an interesting study, and I can't recall the citation. Sorry, I don't remember the researchers. It's probably fairly easy to look up, but they did a test. They did a research study where they looked at an elderly population, and they split them up into one group that did brain training exercises, and then one group that learned a skill such as learning how to edit photos on the computer or learning how to crochet. And it turns out that people who learned a skill actually had a greater improvement to their cognitive abilities that lasted longer.
Wow.
The theory is basically in your brain, the cells that communicate back and forth are called neurons. And when you're young, you're constantly pumping out new neurons, which is why it's so easy to learn things and pick up new skills. As you get older, you still do, but to a much lesser extent. And it's hard to pick things up in the same way. What you can do is you can always connect those neurons you have in different ways. And that's what seems to happen when you learn new skills is you kind of forge a new pathway. And the more pathways you have, the more sort of interconnections you have, the brain tends to run a bit more efficiently. So definitely that's one thing that can be helpful there. Hobby type skills. I try to talk to someone about what they're interested in. Maybe they were a pilot and they don't fly anymore. Well, have you ever built model airplanes? That would be a really good kind of parallel thing to do. Or a language, music, dance class, anything where you're picking up a skill and trying to master it.
That's really interesting. Now I got to make a list of things I want to learn how to do.
Yeah. I mean, even things like getting a board game, but one you haven't played before, and like just trying to wrap your head around the rules for that. You're challenging your brain a bit. You're challenging that executive functioning, challenging that memory. And you don't necessarily have to master these things to see the benefit from it, but it's helpful to sort of treat your brain like a muscle and stretch it in those ways.
So is there any other practical advice that you find yourself giving to Parkinson's patients often?
I think when you go through the assessment process, it's really helpful because you can look at someone's strengths and weaknesses and see what's going to be the most helpful advice for them. A lot of people will be like, well, should I be driving anymore? And, that depends. It depends on how slow the processing speed is. It depends on other factors. But naturally, what you're going to do is you're going to start to adjust. If you can drive still, you're probably going to be driving a bit slower. And that comes down to physics. When things come at you faster, you have less reaction time. When they come at you slower, you have more reaction time. So just sort of going with the flow of that, adjusting things to help fit with that while still challenging yourself. It's easy for people early on in the stages to kind of be a little bit, I don't want to say lazy, but there aren't a lot of major issues that are happening yet. So they're not going to be super active in trying to do something about it. But, getting into fitness classes, finding new hobbies, all these things that are good for you, they're going to be a little bit more complacent about that until it starts to take hold a bit more. I think earlier on, the better. So often there's like kind of a little spike initially with the diagnosis. We're like, oh, holy crap, I have Parkinson's. And then it dips down. You just kind of live your life. And then you start to have difficulties and you circle back to what can I do about this? So just sort of establishing things early on that would be helpful. Habits, routines, things like that are good.
Great. Anything I'm missing?
I guess so you mentioned you also mentioned the psychological side, so like more the emotional side. It's often that people who have Parkinson's will get dementia, or it's not dementia, but that does happen sometimes. But depression is what I was trying to say. Depression, anxiety, other psychological issues. It seems to be that there's kind of a combination of factors. Like one, it sucks to have Parkinson's, and that's depressing.
For sure.
Another is that the neurological changes that happen seem to lend itself toward that. Especially with things slowing down. It's hard to be motivated when you're working an uphill battle for everything. So, as soon as there are concerns, and if you're having a hard time with it, I think it would be worth seeing a therapist or a psychologist. You don't have to be diagnosed with a psychological disorder to benefit from therapy necessarily, especially if it's sort of like, okay, I'm having a hard time adjusting to this. You can go to therapy for a relatively short amount of time, a few weeks, a month, a couple months, and just learn some skills, some coping skills to help deal with anxiety or depression, some things to keep in mind. And that's sort of like a tune-up that will keep you going for a while.
Do you feel people are more open today to psychological counseling than they used to be?
It depends on the population we're talking about, like the age. Certainly there are cultural, gender, religious differences, all sorts of stuff that plays along with this. I do still encounter, I work with a lot of older adults, a lot of people who are, 60, 65 and older. And right now, still a lot of them, I'll suggest therapy and they're like, what the heck are you talking about? Like, why would I like lay on a couch and talk about my mom? They'll think about that sort of thing and they don't see how it might be useful. Nowadays there certainly is that type of therapy. You could have hardcore psychoanalysts who still operate very much like Freud did. But for the most part, people are a lot more solution focused. They're a lot more, the majority of therapists now are what are called cognitive behavioral therapists, which means they look at how your thinking interacts with your behavior, so your interpretation or your assumption about a situation, that's going to make you feel a certain way, which in turn is going to make you act a certain way. So kind of breaking down those patterns, helping you realize where you might be shooting yourself in the foot in terms of your interpretation of situations and having you, use some tools to maybe counteract that a bit. So it's a lot more practical many times. So once I explain it in that way and sort of the way that I'm talking with you about it, people who are older tend to sometimes be more open to it. But there still is, especially among older generations, a stigma there. Younger people, it's a lot more common. You hear about it talked about a lot more, especially if they're online on social media and such. There's much less of a stigma for it. But still, people do think that they need to be suffering bad in order to get therapy sometimes, which isn't always the case.
Robert, thanks so much for your time. I really appreciate it.
Yeah, my pleasure.
So that is your extra dosage. As always, we're always very grateful to have Parkinson Canada as a partner for this podcast. And you can find more information at parkinson.ca.
On the next episode of When Life Gives You Parkinson's.
How's Becky doing?
My husband's changing, and it's scary.
I hate that disease. And it was pretty easy to hate her because the disease lived in her.
Yeah.
And so she saw that that's where we were going. And that's not a good place.
What do you think is the hardest part of what you're going through?
A sense of loneliness.
If it's just you and the person who has Parkinson's and that's it, you don't have any family members or friends or outside supports that are sort of seeing what's going on with you, that can be dangerous because you may not realize that you haven't been sleeping. You may not realize that you're sort of decompensating in these ways. But if you were to, have regular meetings with friends of yours or family members, they can go, whoa.
Do you find that you have time for self-care?
Well, first, if you don't do that, you're going to end up probably being a bitter, resentful person.
The joy offers you freedom, and there isn't so much freedom in the dark moments, but there are lessons in them. Since I'm not currently in one of those dark moments, I can have that perspective.
And that is your extra dosage.
From Curious Cast, this is When Life Gives You Parkinson's.
If you'd like to help spread the word, be sure to rate, review, and subscribe for free to this podcast. We are available on Apple Podcasts, Spotify, Google Podcasts, and everywhere you get your streaming audio. You can also listen at curiouscast.ca.
This is a simple way to spread the word and raise awareness for Parkinson's disease. Engage with us on social media. On Facebook, Instagram, and Twitter, just look up @Parkinson'sPod or email us parkinsonspod@curiouscast.ca.
And of course, be sure to check out the show notes for more information about what you heard today and links to all of our guests as well. With a big special thanks to Dr. Robert Duff from the Hardcore Self-Help Podcast. He's Duff the Psych on YouTube, Twitter, Instagram, Facebook, and at duffthepsych.com.
When Life Gives You Parkinson's is written and hosted by me, Larry Gifford, and Nikki Reitmeyer. Dila Velazquez is our story producer, and sound design by Rob Johnston.
Keep positive.
Keep exercising.
And keep listening.
We'll talk to you next time.
Canada may be known for its landscapes and friendly people, but beneath the surface lies a darker side of crime, history, and the paranormal. Since 2017, the award-winning Dark Poutine podcast has explored the shadowy corners of the Great White North and beyond, delivering chilling tales from a uniquely Canadian perspective. Hosted by Mike Brown and Matthew Stockton with over 300 episodes and fresh releases every Monday, Dark Poutine is your weekly ticket to the creepier side of Canada. Listen to Dark Poutine on Apple, Spotify, Amazon Music, or wherever you get your podcasts.